Hi, this is Jasmine again, coming back at you, and I'm going to talk about pain management in regards to postpartum and a little bit of intrapartum uh, when in terms of labor and delivery. So, where does pain come from? If she asks you, you have to be able to know uh, what's causing her pain. Also, what we want to know is the different types of pain, which stage of labor these pains should be occurring. And we also want to know what factors influence her pain. So let's get started. All right. Hey, why does a woman get contractions? Okay. A woman gets contractions because she has a decrease in blood supply to her uterus. Okay. When that cervix dilates, it causes stretching, which stimulates the nerve ganglion in that area. Okay. And that's what's causing the pain. In another video, I reference um, like your uterus in regards to trying to expel not only the baby but the placenta, and it's going to cause pain. Um, yeah. So, what are different types of pain? So, the first type of pain is somatic. Okay, easy way to remember somatic because it has an S in it. There are three S's associated with somatic pain. You have sharp throbbing pain, burning. Also, she might feel like, oh my god, it burns. Uh, Skin, as in it affects your skin, mostly period area, and your soft tissues. Okay. Visceral pain is visceral. The good way to remember visceral pain is vision. You can't see it. It's hard to pinpoint. This pain has diffused to all the other internal organs in the body. Um, so you just want to let her know that if she may be experiencing visceral pain. Now, the different types of pain are associated with different stages of labor. Okay. During the first stage of labor, the woman is going to experience back pain and stomach pain. Okay. And that's due to dilation and contraction. And that is more so visceral pain. During the stage, um, second phase of pain, second stage of labor, that has to do with your somatic pain. Why? Because what's happening is during the second stage of labor, she's pushing. You have all this pressure build up in your cervix area, causing sharp throbbing pain in your period area and your soft tissues. So that is with that somatic pain due to all that pressure buildup. Now, the third stage is similar to the first, visceral pain. Why? Uh, because what's happening is that now the pain is mostly, or can be mostly in the, now the baby is descending, and that pain in there is still really hard to pinpoint. So the thing to remember with pain for the stages is that the first and the third stage are very similar. The first one is usually during the first stage of labor, and the second pain stage is with the second stage of labor and it's somatic. Okay. Now there are factors that influence pain. Okay. One of those factors that can influence pain is experience. Okay. So if the mom is a new mom, she didn't heard all the horror stories. She is probably not too excited about experiencing pain like this for the first time. Another factor that can influence pain is culture. Culture plays a role in pain because, for example, you have two different types of people. You have stoic and emotive people. Stoic stoic people who express pain are the people who usually tend to grin and bear it. Okay. In some cultures, they may look down upon as, or see a woman as weak if she expresses pain. Emotive pain is or expression is when the woman verbalizes, I'm in pain, like I need pain medication now. Okay. So there's different types of culturally things that women do when they're expressing pain. Another thing that influences pain is the baby, the passenger, right? The baby can influence pain based on the baby's position in the womb. We prefer the baby to be an LOA or ROA. That means right occipital posterior and right occipital posterior. I'm sorry, I lied. LOA or ROA. I mean, the LOP is good and ROP is good, but we really want the OAs. Um, And if the baby is not a macrosomial baby and easy passage, easy delivery, right position, the station is great, uh, stuff like that. Another thing that can influence this pain is the passageway, the cervix. Now, there are four different types of cervixes that we prefer, uh, no, that we actually have in labor and delivery. The best one is a gynoid cervix. Um, that one is easy for the baby to descend down. It's more so shaped like the head of a child. The other ones, like android or platyploid, are not good. Uh, they're not ideal shapes. So that's the way that the passageway can be affected and influence pain because that may make the delivery prolonged. Um, Another factor that can influence pain is feelings, anticipation, right? How's she gonna feel when she finally has to deliver a baby? Okay, she may feel fear and anxiety. Now, fear and anxiety cause problems, and here's why they cause problems. They cause problems because fear and anxiety increase stress. Stress in labor delivery alters the labor process. Okay. And if her pain is not under control and her needs are not being met emotionally, uh, getting this fear and this anxiety under control, that's going to affect her labor process. It's going to be hard, long, and horrible, which may increase her complications. Um, Speaking of support systems, another thing that can uh, influence pain is support systems, right? So it's the father there. Does she have family there? But one of the things that we're going to talk about later, well, I'll say it now, is a doula. Okay, a doula is a non-medical person that is there to support the mom throughout the whole pregnancy and throughout the labor process. Okay, the doula, however, is not a medical personnel. They're not. So when I say that, that means that although they are the patient advocate, we are the ultimate patient advocate. Okay, not to disregard the doula and what doulas do, but they cannot talk to the PCP directly. They can't make recommendations for medical care and stuff like that. They can't do any type of care plans or anything like that. That's our job. Um, Another thing that influences pain is education. Did she take prenatal classes? Does she know what to expect? Does she And that has a lot, that plays a part when you're talking about a 29-year-old giving birth versus a 16-year-old. They may not know, they may be scared, you know. So education plays a part too. Um, Another thing that influence the so one of the other things we're going to talk about is nursing responsibilities. So with pain, nurses have responsibilities for our patients. Okay? One of those things is assessment. Um, we're going to do an assessment, but we also want to make sure that we provide a environment where she feels secure, she doesn't feel fearful, and she's supported. Okay, so how are we going to do that? We're going to encourage, we're going to praise, we're going to recognize her efforts when she's in pain. Okay, and happy feelings help pregnancy. Help the labor process go great. Um, and another thing that we have to do as nurses, let me write this down, is education. Education in regards to non-pharmacological methods early. Okay, we're not just going to your 6 centimeters dilated and you're like, I want epidural. If everything's going fine, we're going to start with non-pharmacological methods first. If the pain is too unbearable, because pregnancy pain is true pain, then we're your patient advocate, so we're gonna ask the doctor, okay, maybe you should give her an IV, Sadol or something, please. But non-pharmacological methods first. Now, talking about nursing interventions, when the mother is at 8 centimeters, which three drugs do we not give? We're not going to give her at all morphine or Demerol. All right. These drugs have severe respiratory depression. Demerol can affect your heart. So we're definitely not uh, going to give you, and not only do they affect the mom, they affect the baby severely. Like respirations are bad. Um, so we're not going to give those three drugs after 8 centimeters. So some non-pharmacological methods. We're getting to these drugs in a minute, but non-pharmacological methods. Non-pharma is something, I'm going to mention something that your body already has. It's called gate control theory. Okay. What is gate control theory? So, gate control theory means that you have a limited number of receptors at each cell to signal to your brain of pain. Okay. So, a non pharmacological method to alter your own process would be to do a massaging. So, you, your your back can't send pain receptors at the same time you're sending receptors to aid in that tensing of the muscle. Same thing goes if you have a cramp in your abdomen from running. If you massage it, it feels better. Why? Gate control theory. Another thing that we do um, is you have to teach them these things, these non-pharmacological methods before labor starts. So they're going to have to get classes. This stuff isn't that expensive, especially gate control theory. And it's safe for the mom and the baby. And one of the great things about non-pharmacological methods is that they enhance control for the mom. Makes her feel like she's in control. The more you know about what's happening with your body, that when it actually happens, you won't be so fearful. You won't be so scared. Another non-pharmacological method is effleurage. Nothing wrong. But effleurage is basically sometimes done in the back when the mom is contracting. And it is a circular motion that helps with pain relief. Okay. Another thing that we can do, nurses, is positioning. So during the early stage of labor, preferably the latent stage, that's when the best time to teach a mom is latent stage. Um, Positioning is a key thing. Okay. Uh, you can get her on a ball, a peanut ball. You can get her on all fours. You can have her arched over something to relieve back pain. All fours helps relieve back pain if the baby's in the wrong position, and it can also turn the baby around without trying to physically do it yourself, because that's really painful. Um, yeah, so positioning plays a really key role in non-pharmacological methods, especially when a mom has a baby who's facing the back. Another method is hydrotherapy. So hydrotherapy is great because you basically put the mom in the water. Back is hurting. Okay. So you basically put the mom in water, and it's warm water. It's a warm tub. And you put the mom in there, and it relieves the pressure. It decreases the need for pain. It prevents the episiotomies or lacerations. However, when it's time to give birth, you cannot give birth in there. If you're going to do hydrotherapy, and that's in her birth plane, you need to make sure that she has an ER available, or maybe a midwife that's trained, but she cannot give birth in there. Um, Another thing that it helps too that Jenny mentioned was that if you put rice in a sock, you heat it up. That is a hot application that's helpful. You can do cold applications, numb areas for, yeah, obvious reasons. Another thing that we can do is non-pharmacological massaging. Nurses can do that, or fathers can do that. We can show them before she goes into active labor, because at that time she might not want to be touched. So you might want to do it beforehand. And maybe if the dad, I'm going to go over the Bradley methods, learned this in class, he may be more equipped to deal with how she's feeling and how she's reacting. Because most women in pain, they don't act normal like they normally would because you're in pain. Um, Other things that you can do imagery. Or talk about massaging, music therapy, and self hypnosis. But if you're gonna do self hypnosis, you have to make sure they're in a safe environment and they're not being hypnotized to do something weird. Okay. Uh, and again, doulas are just there for support. They do not make any medical decisions. They do not talk to the PCP directly, and they do not alter the care plan or give medications that are considered herbal in the hospital, especially if we've already given her medication that may alter or interfere with the herbal medication that the doula gave her. Okay. The doula is the patient advocate, but we are the real patient advocate. Okay. So we're going to make sure that is safe for them. Safe. Everything is safe and beautiful and wonderful as best as we can as nurses for our patient. All right. So the next thing I want to talk about is the Dick Reed, the Lamaze Method, and the Bradley Method. All right. So the Dick Reed, focuses on natural birth, the natural birth process. Okay. So hold it down. So these things are things that if you educate yourself on and you want a good natural birth, the Dick Reed says these are things that the mom has control over. The first thing the mom has control over is her environment. Uh, where do you want to have birth? Okay, what type of people do you want around you? This has to do a lot with your birth plan. The Dick Reed also focuses on education. What do you know about childbirth? Did you do your research? Um, because we want to promote a natural childbirth as possible. Another thing that the Dick Reed focuses on naturally, it says that it focuses on relaxation. Relaxation is big, has a lot to do with breathing techniques, and also if you have the education, you know what to expect in your environment is good, you're going to be relaxed. Now, the second one I'm talking about is Bradley. Um, Bradley is a 12-week course for fathers. The first thing I'm going to mention is that this is not a distraction course. This is the dad is taking these classes to help manage the pain of the mother in a non-pharmacological way based on education, training, and experience and knowledge. Okay. Um, they're gonna be active in the actual second stage of labor process because they want to keep mom as healthy as possible. Some of the things that they teach about, they focus on breathing. Another thing that they focus on is psychological. The third thing they focus on is massaging environment. Now, since the dad is going through all this training, let's sit down because I'm back. Okay. All right. So since the dad is going through all this training, it's a 12-week course. He's learning about different types of ways to manage the pain of the mom, and different type of ways he could be of support. Most dads, first time dads, they usually don't know what to expect. They usually don't know what to do. So this is a good 12-week course before she actually goes into labor to help train him on physiologically what's going on with her and things that he can expect and things that he can do. Um, so breathing, I'm going to go over breathing in a minute. But when she's not breathing or she's not breathing right, if he knows how to tell her to breathe, he's going to help her breathe. He may even do it with her, you know. Psychological, like what is her emotional state in terms of not only just her, but preparation for him. It's very important. Um, because again, she's not going to be the same person in pain as she is normally. Pain makes people do some crazy things. And also massaging, like Aries to massage, like if she has back pain, he knows how to do the epidural massage. Um, he knows how to, there's different things like they teach you what balls would help her, what positioning she should be, just stuff like that. And the dad, when he takes this course, he's going to help her with her environment too. Environment, as in, is quiet. It's basically seizure precautions. Okay, it's quiet. Her eyes are closed and it's completely calm, because that's the most important person in the room. Okay, so the Bradley method is a really good method for fathers who want to be active in the labor and delivery process. Um, let's talk about the Lamaze method real quick. So the Lamaze method is very popular because the Lamaze method focuses on childbirth education classes. Okay, so when we're in this class, you're going to focus on relaxation and massaging, counteract that pain. Very important. And then we're also going to focus on emotional support and third, but certainly not least, we're also going to focus on psyche. Now, with the Lamaze method, lots of women they prefer the Lamaze method because they've heard a lot of scary stories when it comes to childbirth. I'm not gonna lie to you. Um, so because of these scary stories they've heard with childbirthing classes and different things, the Lamaze method is a very good way to educate a mom on the birthing process because it addresses these things. You're gonna have to know how to relax. Okay, it's gonna be very painful. It's like pain and things how ways that you can counteract pain. Also, she's gonna need emotional support. Okay, uh, and this class can sort of help you know what to expect when you're going through labor and just the ups and downs of pain. And psyche, like how's she gonna feel? Like not only when you're in labor, but after labor. So it's gonna help you. These classes are designed to help you adjust to postpartum and interpartum pain. And that's it for now. See you later. Bye.